Namaskar. Welcome to Toxicology on Board. Today we'll discuss about question number 17 in continuation with our topic with solvent toxicology. Today we'll discuss about two more solvents, gasoline and kerosene. Important points with respect to exam, as well as we will also see what are the around seven questions we'll see about the previously asked DABT question on these two solvents. So let's go directly into the topic. Today topic will be gasoline and kerosene. Gasoline causes CNS depression, including respiratory depression, convulsions, sensitizes myocardium, ventricular fibrillation, dermatitis. Aspiration of gasoline can cause pneumonitis and pneumonia. Gasoline does not cause death by pulmonary edema. This is an important point that you have to remember. Aspiration pneumonitis is the major danger with respect to gasoline. Okay. Emesis is contradicted. You cannot use if a person is accidentally consuming gasoline, poisoning has taken place. You emesis cannot be performed on that particular patient. Alpha 2U globulin accumulation is seen in the case of male rat kidney. You have to remember that alpha 2U globulin formation is is gender specific. It is only seen in the case of male rats. It's not seen in the case of female rats, and this is only species specific, rat specific. This particular finding has no clinical relevance. Okay, there is no human relevance. Okay, you cannot you can ignore this effect. It is not considered as an adverse effect. Alpha 2 microglobulin in male rat kidney also caused by what are the apart from gasoline, what are the other chemicals which causes this alpha 2 microglobulin is d-limonene, para-dichlorobenzene and decalin. So all, these three solvents also, chemicals also, you have to remember with respect to alpha 2 microglobulin. Next, as I said, apart from these two solvents, we'll also read some few notes about hexane as well as methyl butyl ketone. Okay, because one of the components in gasoline, hexane, may also be there. What is gasoline? How it contains mixture with various constituents? We'll see in another next slide. So hexane and methyl butyl ketone, these two solvents you will also come across in ICH-Q3C. So I would request you to go back and read ICH-Q3C in that methyl butyl ketone if it is mentioned, what class it is there, whether it is class 2 or class 3 solvent that you see. Because this is a very commonly used solvent in the case of chemical or pharmaceutical industry. So both these solvents are metabolized to 2,5-hexane-dione, and this metabolite which will cause polyneuropathy and CNS depression. These things you have to remember. If in one of your options in your question it is there, you have to remember. Next, parathesiasis in extremities and neuromuscular weakness is observed whenever there is exposure to these two solvents. Kerosene can cause CNS depression at high doses. So whenever at high dose exposure is there, kerosene is causing CNS depression and irritation of the GI tract. Okay, aspiration can cause pneumonitis, also producing kerosene cuff and rails. So you can see gasoline is also causing pneumonitis. Even kerosene is also causing pneumonitis. Additionally, aspiration of kerosene causes kerosene cuff and rails. I have written my exam in 2023 DABT, but I didn't qualify. I think in 2023 they asked one question on kerosene. Turpentine cause CNS depression, nephrotoxic effects, irritates skin and mucosa. You have to remember this solvent also. Okay. So what are the major effects this particular solvent is causing? So if you see multisystemic toxicity profile of gasoline compounds for exposed workers. If there is an exposure to gasoline, reactive metabolites are formed and it will lead to oxidative stress. As you know, that one of the major way for causing any kind of cell damage is the oxidative stress. So whenever there is gasoline exposure, it leads to oxidative stress, which is leading to multi-organ toxicity. As you can see, it is affecting dermal, hemato, reproductive, respiratory, kidney, cancer, musculoskeletal, immunotoxicity, DNA damage, heart, liver toxicity, ototoxicity, toxicity as well as visual effect. Okay, remember this one because based on this, one of the options in your question, if you come across, it will be easy to identify. Okay, so let's see. As I said, gasoline is a complex mixture of hydrocarbons, is toxic and highly flammable, with some compounds like benzene posing a cancer risk. So one of the major component in the gasoline is benzene. Exposure can occur through what are the various routes, through inhalation, through dermal as well as through oral route, leading to various health effects. What are those health effects means? These are the things. Okay. The next, as you have to remember, benzene also go and check back if it is there. It is listed under ICH-Q3C or not. What class solvent it is there that you check, and it is a known carcinogen. Okay, toluene and xylene, okay, present in gasoline can cause drowsiness, dizziness and other neurological effects. In our previous slide we have seen that toluene or xylene causes neurological effects, so which is severe adverse effects. Okay, next we'll see what are the levels of exposure and what are the kinds of damages it is causing. Gasoline, if it is mild exposure, it is causing irritation of the skin, eyes and respiratory tract. As you can see, it is impairing visual effect. It is causing dermal toxicity, dizziness, headache, nausea and vomiting. Okay, if there is a moderate exposure, then CNS related effects are seen. You can see that it is causing drowsiness, it is causing confusion as well as neurological effects. If there is a prolonged exposure or severe exposure, it is causing coma, seizure as well as death. Okay. So now let's directly go to the questions. These questions have been previously asked in recertified questions, I guess. So it was there with me with DABT notes. So I have um, put around 7 questions in this particular video. Let's directly see the questions. Exposure to all the answers are there in the first two slides. If you have properly been attentive to the first two slides, you will be able to understand these options and questions. Exposure to commercial preparation of hydrocarbons such as gasoline can lead to option A dermatitis, option B toxicity from constituents such as benzene, option 3 aspiration pneumonitis, option 4 coma. The right answer is E if all are correct, because gasoline, it will cause skin, it is affecting skin, it is causing dermatitis, it is a C toxicity from constituents such as benzene. Benzene is a major component. It is causing aspiration pneumonitis and severe exposure we have seen it is causing coma. Next, let us see second question. Inhalation or ingestion of a toxic amount of gasoline may lead to development of option 1, which is ventricular fibrillation, option 2 is pneumonia, option 3 is respiratory depression, option 4 is convulsions. Again, the right answer is E, all are correct, because it is affecting heart, it is affecting your lungs, it is also affecting your CNS. Okay. Next, we'll see question number 3. Which of the following is or are correct? Option 1. The toxicity of gasoline is related mainly to the concentration of benzene. Actually, it is not related to concentration of benzene. Benzene is one of the major component, but it's not related. It is not directly proportional to concentration of benzene. Option 2. Aspiration pneumonitis is a major danger when gasoline is ingested. First slide, you have already come across this statement. Prolonged exposure to gasoline vapors can cause death due to respiratory failure because of severe pulmonary edema. Prolonged exposure will cause coma and death. Okay, CNS related effects are there, not respiratory related effects. Okay, severe exposure. Option 4, emetics are contraindicated in the therapy of gasoline ingestion, which we have seen previously. So the right answer is option C if only 2 and 4 are correct. Okay. Let's see question number 4. Okay. Question number 4. Which of the following procedures is are contraindicated in the treatment of intoxication with gasoline or kerosene? Okay. Contraindicated. Emesis or gastric lavage. Correct. Emesis is contraindicated in the case of gasoline poisoning, and Option 2 is correction of fluid and electrolyte imbalances. This is not. Administration of epinephrine is also not encouraged, not recommended in case of gasoline or kerosene poisoning to a particular patient. Symptomatic and supportive care. The right answer is option 1 as well as option 3. Okay, 1 and 3 are correct. Green I have already highlighted, means these are the right answers. The next option, question number 5, we will see aspiration pneumonitis is a common clinical result after ingestion of, okay, kerosene. Whenever there is a kerosene exposure, there will be as you can see, the lung is the respiratory system is the major target organ and it is causing aspiration pneumonitis, common clinical result of even after oral exposure. Because generally what happens, nowadays we are not using kerosene, but if you see early 19th, kerosene was one of the household cooking purpose also they used to use. So there was accidental, so kerosene was there in the in our household products where children used to accidentally consume this kerosene. Okay, let's see the sixth question. The clinical presentation associated with ingestion of kerosene is usually hydrocarbon pneumonitis. So up to four questions were mostly on gasoline. Next three questions are on kerosene. Remember like that. Okay. Next question number 7 we'll see toxic effects from oral ingestion of kerosene are described by which of the following? Option 1 due to local irritation of the alimentary tract. Okay. And option 2 not life threatening unless large quantities are ingested or unless it is aspirated. Option C CNS depression, low grade fever, and loss of consciousness with larger doses. Option D produces bone marrow suppression at low doses. This is actually associated with, I think, benzene, and this is not life threatening. Okay, by ingestion unless it is aspirated. That is the reason option 1 and option 3 are correct. Yeah, these 2 points are already covered in the first slide. If you remember the notes, you can easily answer this question. So option B, 1 and 3 are correct. Okay, hope in this video you have learnt about two solvents, that is the um, that is the uh, kerosene and other two solvents, hexane and methyl isobutyl ketone. The related questions I will discuss in upcoming video. Thank you so much. Be curious. For any questions, please comment and mail to either arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on the Board. All the best for your exam. Thank you.